Hello, my name is Erin Blalock, and this is my project proposal and poster presentation for Eastern Kentucky University NSC892. Medication adherence is a major problem for individuals with mental health disorders. Research shows that up to 60% of these individuals stop taking their medication within 60 days of it being prescribed. Medication non-adherence leads to relapse of symptoms, readmissions to the hospital, higher medical costs, and overall poorer patient outcomes. There have been many studies done to try to solve this issue. The studies show that an increase in patient and provider contact improves patient outcomes, including medication adherence. Phone interventions and other technology help to bridge this gap and increase connection between providers and patients. My proposal is to initiate phone calls to individuals within 72 hours of being discharged from the crisis unit. These phone calls will be performed by either the case manager or the nurse, and the individual will be assigned who is going to call them prior to them leaving the unit. During these calls, the caller will perform the MARS questionnaire. This is a simple 10-question questionnaire that judges the patient's medication adherence, their current medication adherence, as well as their feelings and thoughts towards medication adherence. Using this questionnaire, we can identify those who are either non-compliant or are at high risk for becoming non-compliant in the future. The MARS really helps in identifying those that have negative feelings towards medication. They may not understand their medications. It addresses side effects towards the medications. So this is a really great tool to open up those lines of communication and to really help be able to answer some of those questions for the patients. For any of the patients that answer yes to more than 5 questions, they will be given weekly phone calls that will continue after this initial phone call, which is done within 72 hours of discharge. The plan is to conduct these phone calls over 3 months and to monitor the outcome. The effectiveness of these phone calls will be judged based on the questionnaire responses, readmissions during that time, and also 30-day readmissions. After 3 months, the results will be tabulated and disseminated to all of the stakeholders. In order to implement this plan, the first step will be to develop the team, develop who the leadership will be, what each person's role will be, to identify who the stakeholders are, the patients, the providers, the nurses, case managers, the organization as a whole, and the community and patients' family members. Then the next step is to do the research, to do the systematic reviews, the randomized controlled trials, to look at these studies and see the results. Some of the studies that I have already done show very promising results. The systematic review that I looked at showed that 10 out of 17 of these studies showed positive correlations between using technology, telephones, text messages, and increased provider contact, and it showed those positive correlations with medication adherence when those items were used. Another randomized controlled trial used specifically the TIPS, T-I-P-S method, which showed 100% improvement in medication adherence during their study, which was about 2 months long. Patients, during some quantitative questionnaires, often cited forgetfulness, medication side effects, and being unsure about their medicines, being unsure that it helps, as some of the reasons why they stop taking their medications. By increasing provider contact, by calling the patients after they are discharged, this will really help to mitigate some of those problems, to answer their questions, to address the side effects, and just to allow some extra support to be given to the patients. Medication non-adherence is such a large problem, and it causes so many issues. It truly is the cause of almost all relapse of symptoms and readmissions to the hospital. So any way that we as providers and caregivers can help to bridge that gap and really, improve medication adherence is the most important thing that we can do. So by using my plan, so we develop the team, we identify our stakeholders, we've really developed our PICO question, we've done the research, so now the plan is to implement it. Like I said, we plan on doing this over a 3-month span, so the patients that are admitted during that time will be informed of what we are going to do. They will be assigned a caller, so who is going to call them? Most likely it will be their case manager, because they have daily contact with the person. Each day that they are on the unit, they'll have the same case manager. Same case manager will take care of their case the whole time they're there, so they should have a good relationship with them already, or at least, working they know who they are. So the case manager will give them the phone call. They will do the MARS screening. If there are any extra questions, they can be relayed to the nurse or the provider, just depending on the question and the severity, the in-depthness of the question. Those things can be relayed to the nurse, and then they can be given a call back to answer those questions. So the plan is to implement this for 3 months and to judge the patient answers to the questions compared to the readmission rates, and especially the 30-day readmission rates, because those are kind of one of the major things that the state really looks at as far as effectiveness of treatment. So the hope is that at the end of 3 months, we will review the information. We can see what went well, what went poorly, what we can improve on, and we will then share all of that information with our stakeholders and make changes if needed and proceed with the project if it is beneficial. So, thank you, and I look forward to seeing how this all goes.